And Robert, at what time I'm supposed to end?
I think the cutoff is 4 o'clock, or yeah, 4 Eastern.
Oh, I have all that time? Oh my God, okay.
There might be a 15-minute in between, but
Okay, and what about if you put me on the chat, how many minutes I will have?
I can do that. That sounds good.
Thank you.
Good afternoon, everybody. We're going to go ahead and get started here in just a second as folks start to trickle in. My name is Robert. I have the the Nacho Zoom name for technical purposes, but you can call me Robert. I will be assisting with the technical assistance and managing chat. Yeah, so glad to have everybody here.
There is an attendee raising the hand.
I see that. Um, if you I think what we'll do is if you want to raise, if you have your hand raised, if you could leave a message in the chat for folks. Wait, let me double check the interpreter.
Robert, and I think if you can help me look to the comments or whatever, that'd be great. It's okay if you interrupt me to let me know, because it's hard for me to see other people here
Mhm.
or
I can do that.
actually see the hands or whatever. It seems like we have like 37 persons, right?
Yeah.
Okay, good. So should I get started?
Yes.
Okay. Well, good evening or good afternoon or good morning, whatever are you right now. My name is Betsy Rodriguez. I'm a senior public health advisor at the Division of Diabetes Translation. I'm a person living with diabetes. I'm a national board member, and it's my pleasure to be here talking to you all in one of the areas that is I want to say one of my greatest passion. It's inclusion or engagement of community health workers in the diabetes field, which is my area of expertise. I'm wearing today my Nashua t-shirt, so proud to use it today. I got this from as a board member when I was initiating in that role 2 years ago. And so today we're going to be having interesting conversations around strengthening community health workers' roles in the intersection of diabetes prevention and diabetes care. So we're going to be talking about how community health workers could be better integrated into the team-based care approach for those like me who are living with diabetes 24/7, 360 something days of the year, because what happens is that when you're living with a chronic condition with diabetes, you can't take vacations at all. If it came to stay, I will stay with you for the rest of your life. And let me tell you, sometimes living with diabetes really sucks. It is not an easy aspect to living with a chronic condition like diabetes. There are so many things that has to be taken into consideration. And that's why I see the value of community health workers be engaged in diabetes prevention and care, because definitely you are at the community level. Some others are at the healthcare system level. Some others are at the social level. Whatever level or whatever setting you are working, I bet you will be serving people with diabetes, because this is one of the top leading problems in public health right now as we speak. I bet if I ask you how many of you have diabetes, I might find some people who are in this room right now who are living with diabetes like me. But if I ask if you know someone or you have a relative to have diabetes, I bet the hands will be even more. And if I ask you how many of you are serving people with diabetes and their families, I bet I will get even more hands up because diabetes is so prevalent. It's one of those chronic conditions that is especially high prevalent in priority populations, the so-called ethnic minority groups in the past, Hispano-Latinos, African-American, Asian and Pacific Islanders, and American Indian, and those who are living in rural areas as well. And I can keep breaking down into living with disabilities, for example, living with mental health issues. And there are so many facets that we can take a look into this. And I truly believe that community health workers can make a difference. So let's deal into this topic that we have in front of us today. So let me see if I can find here. Okay, here it is. I have nothing to disclose. But the presentations not necessarily represent the view of CDC, rather the views of the speaker. Our objectives for today's are going to be around understanding the unique roles that community health workers can play in type 2 diabetes prevention and in diabetes care. We're going to be also exploring some resources designed with input from community health workers and individuals with diabetes. And we're going to be talking about learn actionable strategies and tools for improving diabetes in our communities. So let's start talking about advancing equity in diabetes prevention and care. Diabetes is the 8th leading cause of death in the United States. You were aware about that? It's the 8th leading cause of death in the United States. And it's more common among people who are members of some racial and ethnic minority groups with lower socioeconomic status. Since in inception, CDC, Division of Diabetes Translation, where I am working right now, has been working to reduce and one day eliminate health disparities for all Americans who are living with diabetes or who are at risk for developing especially type 2 diabetes. DDT is committed to ensuring that every person has the information and the opportunity to prevent or delay type 2 diabetes and to live well with diabetes. We partnered with a broader public health community to address health disparities and work toward achieving health equity. We have working tireless with community health workers at many different levels. At the center of our work in DDT, our efforts are to prevent type 2 diabetes through the National Diabetes Prevention Program, which is a year-long lifestyle change program, and to improve care and quality of life for people living with diabetes through supporting access to diabetes self-management education and support services, before known as diabetes education. So how many of you have heard about the National Diabetes Prevention Program? I believe you can open your mic and share with me if you have heard about this. I see some emojis. If there is anyone that would like to speak about the knowledge they might have to the National Diabetes Prevention Program.
If you would like to raise your hand and I can unmute you. So that's what we'll do.
Okay, good. Thank you, Roberto. So who wants to be the first one who start talking? Let's make this like a conversation as opposed to me being here the talking head for you all. So who knows anything related to the National Diabetes Prevention Program? Who want to talk about it? Have you ever heard about the National Diabetes Prevention Program? CDC, Division of Diabetes Translation, recognize programs that follow the standards that we have for quality control purposes, ensuring that people with diabetes, people with pre-diabetes can enroll the program. And as I said, this is a year-long program that help people delay the onset of type 2 diabetes. Did I hear a voice?
Hello.
Yeah, so I think, yep.
Hi,
Go ahead.
this is Eudora in Seattle at Center for Multicultural Health. Pre-COVID, we were tapped to teach this program. We had been previously doing diabetes education here, and this was a program when it was first being rolled out that CMCH took on and was teaching in the communities. I took it to senior residences here in Seattle and held classes there over a time period. So we are familiar with that, and there are parts that we think are very well, and I like it a lot because it was similar to our program in that it was ongoing. Our original program was 12 weeks that we held quarterly, and then we added DPP to it, and was one of the, I think, the very earliest ones that were doing a pilot on how to incorporate this into our local communities. Thank you.
Thank you, Dora. Thank you for sharing that experience. Yes, the National Diabetes Education Prevention Program has been in the trenches for quite some time. We have two curriculums in English and in Spanish. Actually, we have in other languages too. And the Spanish curriculum, I was the one who wrote that one for the Spanish Hispano-Latino communities. And they are available in our website to be downloaded. We are encouraging community health workers to help us increase awareness at the community level of the assistance of the National Diabetes Prevention Program. We have a program locator, so community health workers can help people be recruited in those programs. Those programs has hired many community health workers that are acting as lifestyle coaches, teaching the courses and helping people prevent type 2 diabetes. There are so many other type of modalities out there, but the National Diabetes Education Program is supposed to be a year-long program. And let me tell you why. Because there's science behind the structure of the program, and what the science has been teaching us, that a person with prediabetes who enroll in a year-long program like the National Diabetes Education Program can actually prevent or delay the onset of type 2 diabetes by more than 50%. And actually in older adults, more than 70%. But it has to be guided by a coach. And these people will be focusing in participating in this education aspect in very critical areas like healthy eating, incorporating physical activity, watching the level of stress, watching the quality of sleeping, increasing water consumption, weight reduction, 3 to 7% of the body weight. Those are the strategies that are the driving forces within the National Diabetes Prevention Program. And it will be awesome if you can go to our website, find the programs that are in your area and refer people to those services, help them navigate the system so they can get the benefits of the National Diabetes Prevention Program. On the other side, for those who have diabetes already, then we have the Diabetes Self-Management Education and Support Services. There are two national organizations who certify or recognize diabetes programs, and those are the American Diabetes Association and the Association of Diabetes Care Education and Support Specialists. Those two recognize or accredited programs to ensure again that the quality of the services being provided is to the highest. And both organizations also has a program locator. I will encourage you all as community health workers to know about these resources and get connected to those programs that will be within the perimeter of the communities that you serve. So let's move on. While we know that we have programs or services like the National DPP of the National Diabetes Prevention Program, and we also have DSMES services available, the overall utilization is low and there are many obstacles that can stand in the way of getting the needed care and the support. People living with diabetes and the people who help care for and support them face endless number of decisions, which are often hampered by limited access to needed resources, especially adequate food, medications, and monitoring tools. These social and environmental contexts are not only linked to poor health outcomes, but the longer the amount of time that someone lives in an environment with limited access to resources, the greater disparities can be in prevention and treatment, and the greater evolution of diabetes-related complications to people who are living with diabetes. So equitable access to care and supports to help prevent and to manage a chronic condition like diabetes is essential, so all of them can reach the highest level of health. The pandemic actually highlighted the persistent problem that we have in health disparities, with some racial ethnic group at an elevated risk of severe complications related to higher rates of diabetes, heart diseases, and other underlying health conditions. So lack of access to food, let alone at risk for developing type 2 diabetes, and make it harder for people to living with diabetes to manage their health, including keeping blood glucose level with the target ranges and avoiding complication and hospitalizations. Again, the science is telling us that those who are living with diabetes that keep their blood sugar levels as close as possible to normal values, what is called time in range, those are the ones that will prevent or delay the onset of type 2 diabetes. And the first role that community health workers can play in this endeavor is helping the myths that are out there that having diabetes is a sentence to get blindness or being amputated or developing the other diabetes related complication. No, does not have to be the future, because diabetes is not a sentence of death unless that person is not keeping the blood glucose level within a time in range. And the science has been teaching us that if the person living with diabetes keep the blood glucose levels in range, like 70% of the time, chances are that that person will be able to delay the onset of diabetes-related complications. Diabetes does not have to be the destiny to our people, to our communities. So we have to play a critical role here in telling the people the good news that type 2 diabetes can be prevented. And if you get it, you can avoid diabetes-related complications. So what are the roles of community health workers? I don't have to teach you this, but I would like to take a time here so we can make some reflections on what are the things, what is the power of community health workers in the communities they serve through the roles they play. For example, we know already that community health workers play a vital role in improving health and well-being, especially when they do, for example, education and coaching. They can provide guidance on type 2 diabetes prevention and diabetes management, but more important, they can empower individuals at risk or living with diabetes to better understand their condition and access the necessary services and care. Community health workers can help identify those barriers by building trust with people who have diabetes. Community health workers can identify those barriers to care, especially those that are related with the social determinant of health. These help healthcare professionals better understand and respond to the people's needs. Sometimes people speak with community health workers, have conversations with community health workers that they will never have with the healthcare providers. So loop in back to the provider. That's a critical role that community health workers can play when they are integrated into the team-based care approach. And improving self-management. CHW engage in education, in coaching, in that social support to enhance diabetes self-management behaviors is important. And these include promoting testing, monitoring, medication management, diet, physical activity, weight management, emotional support. All of those factors for a person like me who's living with diabetes play an important role. Let me tell you. Name me an organ, and I'm naming you a diabetes-related complication. Name me an area of a well-being life, and I will tell you how diabetes can easily mess it up your life. Like, for instance, being here talking to you all, I have to check my blood sugar first. Why? Because I want to make sure that my blood sugar will not be low, and I will be acting weird when I am doing this presentation because my brain is not working well. You know, as a person living with diabetes, I have to think in so many things that will impact my well-being that nobody's aware of unless you are in my own flesh living the experiences that I'm living through this, what I'm called my best amiga, my diabetes, who came to live with me in my home and is not living from my life. So having that person close by who is motivating me, who is encouraging me, who is helping me find the resources that I need, who's helping me, for example, to find the medications that I have. Let me share a personal story here. My daughter was diagnosed with type 1 diabetes when she was 8 years old. Right now, she's 42 years old. I used to call myself Pancreas Mom. Why? Because I was helping my daughter who was living with type 1 diabetes. That means that she will be using insulin for the rest of the life, which is not an easy task to manage for a child, not even an adult. And here I am trying to do my best to be her pancreas, helping her think about what is it that it takes to integrate diabetes into her life, and what is the role that diet, physical activity, healthy eating, insulin and other medications are interrelated into her keeping those blood glucose levels in time range. It's not an easy task, I'm telling you. So that's what I'm used to call myself, a full-time pancreas mom. Then as she was growing up, I become a part-time pancreas mom. And now that she's 42 and she can take care of herself, no, I'm calling myself, you know how? PRM pancreas mom. And PRM stands for as necessary when it's needed. That's lingo from nurses and physicians. You take the medication for pain, for example, PRN, when it's needed. So I am now a PRN pancreas mom. When she needs me, I'm here for her. And I want you all to be there for every person who's living with diabetes. So I do believe that the roles you play in providing education and support, in helping people navigate the healthcare system, in offer that emotional support, in connecting people with individual or at risk of living with diabetes among themselves and with the services that are out there. So you are familiarized with the C3 core roles competencies. Those are the competencies that were identified by this group of people who actually were the one who conducted the first CHW workforce assessment to identify the role of community health workers. And let me tell you, that was through a group in HRSA in 1998. That was the first time that the workforce of community health workers was studied and identified the core competencies and role for community health workers. Then later on, the same group reunite themselves again and provided what I'm calling a contemporary version of the roles of community health workers, and you have those there. And in the center, in a shape of heart, are the qualities of community health workers were compassionate, respectful, dependable, motivating, persistent, are some of the words that describe the qualities of the care that community health workers provide not only to people with diabetes, but to any community they serve. Then later on, the Association of Diabetes Care Education and Support Specialists wrote a practice document that was with the intention of speaking to diabetes care education and support specialists that were certified on how to engage effectively community health workers in the diabetes care approach. And here in the slide, you see some of the examples of how ADCS was able to identify some of the roles that community health workers can play. But let me tell you, the most frequently reported community health worker role on care teams are helping people gain access to medical services. Number 2, advocating for individual needs. Number 3, teaching people how to use healthcare and social services. Number 4, helping people manage chronic conditions. The most common role community health workers play when they address food insecurity are advocating for individuals and communities, care coordination, case management, system navigation, outreach, and provider of culturally appropriate health education and information, and coach and social supporter. Casi nada, almost nothing, as if I will make a literal translation. Do we have any comments in the chat box? I cannot see it. Roberto, can you help me here, please?
Yeah, we also have someone who raised their hand earlier. I don't know if you wanted to hear from them.
Okay, if there is anyone with a hand raised?
Bill, did you want to contribute anything or?
I just wanted to say hello to Betsy, and I was in New Orleans, so I got to see Betsy there. This is Bill Adams. I am the area diabetes consultant as well as the CHR consultant in the IHS area in Albuquerque. And I just wanted to let you know that, yes, I'm very familiar with the National Diabetes Prevention Program, as well as many of our CHR programs in the Albuquerque area have the benefit to work, if not directly, but close by many of our special diabetes program for Indian programs. And they're through the IHS Division of Diabetes Treatment and Prevention. And they have a lot of resources to provide to those CHR programs too. So just wanted to do a shout out and thank you for what you're doing.
Thank you, Bill. I was in New Mexico recently, and I was able to go to a small rural community. I believe the name is Aprana. It's close to the wall in New Mexico, and it really shocked me how, when we define how rural communities may look like. I have been working in the U.S.-Mexico border for many years, but the Aprana place really was an eye-opener for me, and an aha moment of looking to what are the needs of these communities. But there's nothing. Over there was absolutely nothing. But there was a group of promotores who was working with them and those 250 families working there, making sure that they not only are managing their diabetes correctly, but also that those kids has the vaccines, that they have access to school, that they have food in their tables, the other social aspects that are so interrelated when you live with a chronic condition like diabetes. So I was taking my hat off when I see the wonderful work that a group of promotoras is doing in that community over there. So thank you, Bill, for sharing what you just said. So I don't know you guys, but I have been in the community health workers arena for quite some time, and I'm just so sick and tired when I hear the question, but what is the evidence of community health workers in any given area? I'm so sick of that question. But I think that it's important for all of us to be able to relate what is the evidence and be able to change the narrative that is out there regarding what is the evidence of community health workers, because there's plenty of evidence. I'm going to be showing to you right now some of the evidence. So the first one that you see there is the practice document that ADCS wrote, which is called Community Health Workers as Diabetes Paraprofessionals in DSMES and Prediabetes. And let me tell you, I'm fighting back with them with that word of paraprofessionals. I have been telling you, you have to change that word, They are community health workers, promotores de la salud, or community health representatives. So that's how it is in the Department of Labor with the new classification, and that is the name that that paper has to be there. But taking that aside, I have to say that they have done an excellent job in highlighting what are the roles that community health workers play with people with prediabetes or people with diabetes already. So that's one set of the evidence. The other set of the evidence, it's housed in the community guide. And what is the community guide? The community guide is a bunch of scientific people, subject matter experts, who rolled their sleeve and did what is called a systematic review to show the effectiveness of community health workers, first in cardiovascular diseases, then in diabetes prevention, and third in diabetes management, and after that in cancer. So if you Google community guide, and then once you are in the page, you in the locator, you put community health workers, that will guide you to the central page on the evidence of community health workers. And then the third source of evidence is the diabetes care standards. What are these? Where these are the book of care for people with diabetes, for healthcare professionals. And since 2017, community health worker has been included in the standard of care as an evidence A. What is the meaning of that? That's the strongest scientific evidence that says that community health workers not can only help people with diabetes or prediabetes effectively, but they can also reduce disparities and increase equity. And in 2024, that evidence was included yet again. And if you go to the ADA website on the professional section, you will find the standard of cares. Look under population health, and within the section of tailoring treatment for social context, indicates there that provide people with diabetes with additional self-management support from community health workers. And number two, to consider community health workers to support the management of diabetes and cardiovascular risk factors, especially in underserved communities and healthcare system. And as I said, that's evidence A, the strongest evidence. So, Community Preventive Task Force findings in diabetes prevention, what it says? It says that community health workers, intervention with community health workers from the prevention of type 2 diabetes based on sufficient evidence of their effectiveness in improving what? Glycemic control, weight-related health outcomes among people at increased risk for type 2 diabetes. And some evidence suggests that intervention adapted for the U.S. diabetes prevention program reduce rates of progression to type 2 diabetes, and that intervention that are involving community health workers for diabetes prevention, often implemented in underserved communities, can improve health, reduce health disparities, and increase health equity. So in summary, the community guide recommends interventions involving community health workers based on evidence efficacy and that are integral to the prevention of cardiovascular diseases, prevention of type 2 diabetes, and management of diabetes to reduce the risk of complications. So when someone asks you, what is the evidence? This is the evidence, very robust evidence that we all have to be having in our toolbox when you are saying your elevator speech about the effectiveness of community health workers. I'm sharing with you what is the evidence behind, so you change the narrative when people are asking yes one more time, what is the evidence? So diabetes prevention and care, as I told you before, is a complex landscape. Why? Well, because, sorry, the personal experiences, the family history, the socioeconomic status, and the access to resources, the geographic location, and the local healthcare infrastructure. You all know that based on your zip code is the quality of the schools, it's the quality of the places where you buy your food, is the quality of the neighborhoods that you live in. It's, you know, it's quality to almost every single aspect of your life, and being one of them, healthcare, access to quality healthcare, that it should be not a privilege, but it should be a right. And as a matter of fact, that's part of our constitution. It says that health is the right to every person. So, but while everyone is welcome to join type 2 diabetes prevention and management programs like the National DPP and DSMES services, not everyone has the same opportunity or the ability to access them. Across the United States, some racial and ethnic groups and people with lower socioeconomic historically have their higher risk of developing type 2 diabetes or diabetes complications. And the challenge in managing a complex chronic disease like diabetes is often compounded by barriers in access to needed resources and services. You can see some of these barriers in the slides. So language, that's a huge one. It's, you know, when you don't speak English, it's really hard. I remember 30 years ago when I moved from Puerto Rico to live in Atlanta, Georgia, how hard it is for me. And it wasn't that hard for many other migrant populations, because in my island, as being a U.S. territory, we take English from first grade to high school. So I thought I knew how to speak English until I touched land in Georgia. Because it's not only English, it's Southern English, which is, it makes it even more harder, especially for me, you know. And then after 30 years, I keep this Puerto Rican accent that I have no intention to get rid of it. And but you know, it's your brain and how you have to deal with information, even if you're able to speak the language. Even with a strong accent that I have, it's really hard, I'm telling you. Sometimes, and I have a master's degree, and sometimes when I am in my healthcare providers, I ask for a translation, because it depends the provider that I have there, the accent they might have too, might make very hard for me to understand what he's telling me. So language is a huge barrier. So after you cross the door of having access to the services, then you have some other challenges, and language is one of the most important ones. Then the mistrust in the healthcare. Think about the Black community. Think about the American Indian community. There is a lot of mistrust in healthcare, and they have all the right to mistrust. I'm telling you, when you read the story, you're convinced they have all the right to mistrust healthcare. Medical deserts. Lack of access to healthy food, limited transportation. I was the other day participating on a webinar, and they were talking about what are the implications where you are lacking of transportation to access healthcare. And in diabetes, guess what? Lack of transportation is number one barrier to access quality care. The lack of defined social supports, the low health literacy. Assume that you can write, read, understand English. You still may have addressing literacy issues. You might even be a healthcare professional. You might be a lawyer. I don't know, may have so many doctors or so many letters after your name. You still might be facing health literacy issues. And there are many, many more. Challenges like limited resources and funding, and that comes to programs who are hiring community health workers. How many of you ended doing volunteer services because after the funding left, the program left, but you continue with the same people in the same community, and they trust you, so therefore you are not leaving no one behind? What ended happening? Many community health workers ended working on volunteer basis. There is different levels of awareness of all of these issues, and then navigating complex system could be another challenge. Like for instance, in the system that I am right now is attached to electronic medical record. What a blessing, yes, and what a nightmare sometimes too. So how many times I have found myself looking for help on how to navigate the electronic medical record just to set an appointment. It is, you know, it has benefit, but it's also have challenges. So, and this is nothing related with you living with diabetes. You may have any chronic condition. You need always that support. And then overcoming the language and the cultural barriers. For crying aloud, that's very important. Cultural played a pivotal role. I remember when my daughter was pregnant for the first time, and we went to the first gynecologist visit. So it was my husband, it was my mother, it was her brother, it was me and her husband. And the provider said, well, there's too many people here. Why? And I told him, because she is pregnant, but the baby belongs to all of us. This is a family affair. If you're going to be working with the Borges Rodriguez family, all these members have to be in all of the appointments. You have to make room for us. It was hard for him to understand why even the abuela was there, why the father was there, why the husband was there. I don't know you all, but that's my only daughter. So everybody had to be in that room learning what's going on with that baby. So the level of awareness in cultural barriers, it's an important role. For us in my family, having a baby is a family affair. For me, asking questions it's very important. So my 15 minutes of glory with my endocrinology has to be used to help me answer my questions and to address my cultural beliefs. So that's what I think that community health workers are also very important, because you can break down those barriers that are related with cultural barriers. So as a community health workers, you can also help participants become more active, make healthy food choices, lose weight, and maintain a healthy weight. But let me tell you this something. You have to do what you preach. So what is the meaning of that? If you're teaching people with diabetes or with pre-diabetes, you have to manage your weight too. And I'm here to witness you that it's possible. 3 years ago, I was weighing 345 pounds. Yes, you heard me, 344. How much I'm weighing right now? 160. Am I taking medications? No. Did I underwent bariatric surgery? No, I'm not against that. Everybody has to find their own way to deal with their journey. I decided that my journey will be through healthy eating and increasing physical activity. So now from 344, I'm 160. I go to the gym on daily basis. I spend 1 hour of my time there. I walk every single morning. So now when I am dealing with people who are living with obesity, on top of that with diabetes, I can say, listen, it's possible, it's doable. But I was able to do that on my own? No. I need a whole village who was close by. I actually have a community health workers with me who was the one who was helping me start walking around in my neighborhood, still walking with me to this day, 3 years of journey. And she has been hand by hand with me, calling me on daily basis, motivating me, sharing with me recipes, teaching me how to cook stuff, you know, sending me quotes, sending me verses from the Bible. I mean, she has been doing all kinds of things to keep me my journey to my well-being, to the new version of Betsy. That takes not only courage, but it also takes a person who is walking side by side with you. And I do believe that you, as a community health worker, can do an excellent job in that area. Why? You can increase awareness at the community level about the importance of lifestyle changes needed to prevent or delay the onset of type 2 diabetes. Be an active listener. Become a better resource by learning more about services available in the community, especially to the national DPP or the DSMES services. to encourage participants to make every effort to prevent or delay diabetes or to prevent or delay the onset of diabetes-related complications, to help identify their challenges and ways to overcome them, and motivate them to come up with their own goals and solutions, and help them enroll in any of the two, depending on where they are, if they are with prediabetes or they are living with diabetes. So CHW serve as a bridge to the SMES services, connecting people with diabetes to in-person or virtual programs. Encourage people with diabetes to engage in regular self-management and healthy lifestyle behaviors. ADCS has identified 7 healthcare behaviors that are showcased in that slide that is in there. And if you can see at the center of the model of the ADCS 7 is the person living with diabetes. And what is the first behavior? Healthy coping. And what that entails a person with diabetes, first of all, accepting that it has a chronic condition, and then finding ways on how to cope around the challenges that the disease it's imposing on their life. And then once that person has taken into account that healthy coping, then it will be ready to manage medications, to be physically active, to engage in healthy eating, and then monitoring. Why? Because in diabetes, if you try to self-manage your diabetes without monitoring, it's like trying to drive a car being blind. It's impossible to manage diabetes without proper monitoring. And then around in the external area, it's the more problem solving and the reducing risk. And what we're talking about reducing risk here is about stop smoking, losing weight, vaccines, annual checkup for eyes, daily checkup for food, all of those things that are related to problem solving. Oh my God, problem solving. Let's say you go to a banquet and there's plenty of food there and your actual glucose level is 180. What are you gonna do? You can take your diabetes educator, you can take your community health worker or promotora, you can take your doctor to the beach or to the movies or to a family reunion. You can take them. Ideally, it will be good if they can be my company, but they will not be. So I have to learn how to troubleshoot all the different things that are impacted by living with diabetes. So you guys serve as a bridge to the SMES services, encouraging people around those ADCS 7 and helping them identify goals and solutions and provide that support that is needed. Any questions until here? Help me,
Yeah,
Roberto.
we did have a
Mhm.
question. So one of the questions was any information on gestational diabetes management?
Gestational diabetes management.
Yeah, if there's
Yes.
any information, yeah.
Yes. If you go to our website, www.cdc.gov/diabetes, you will have plethora of resources there around gestational diabetes. And it's available in Spanish too, as we speak right now. Our website has been revamped to change the way we showcase the information of our website. So you will find out that it's now easier to navigate our website and being able to find information there. Plethora of resources around gestational diabetes, yes, and it's available in English and in Spanish. Any particular questions you may have on gestational diabetes? Any other comment or question, Robert?
Not seeing any. If there's any folks that have questions, either leave them in the chat, or if you want to raise your hand, I can unmute you and let you talk.
Okay, so hearing nothing, let's continue. So now this is the part that I enjoy the most because I would like to share with you the resources that we have for community health workers. Excuse me. Let me have some water. We have conversation starters and educational material. We have step-by-step facilitator tools. We have videos and visuals and infographics. And we also have community outreach tools. So let's go now to do some spotlight on some of the resources that we have for you all. So the first one is the Road to Health Toolkit. And I have to say this, all of these resources, I have been leading the development of this. And I am sure you 100% has been developed with input from community health workers to community health workers. So this is not something that was created from staff from CDC or me as a nurse, as a diabetes educator too, as a person living with diabetes, but with inclusion of community health workers since the inception of the idea. And the perfect example that you see here is the Road to Health Toolkit, El Camino hacia la Buena Salud. It is available in English and it's available in Spanish. Was created back in 2008 when I developed the first set of resources for the Road to Health Toolkit, targeting African-American communities. And then in 2008, we developed the same resource for Hispanic or Latinos. You see that the time range between the two. Why? Because it was not a literal translation. It was a transcreation with a huge input of Promotores de la Salud to develop the Spanish version, and African-American communities, community health workers to develop the Road to Health Toolkit. So what is the Road to Health Toolkit? The Road to Health Toolkit is a resource for community health workers to increase awareness at the community level on the importance of preventing the onset of type 2 diabetes on people with prediabetes. It's not a substitution of the Preventive 2 curriculum for the National Diabetes Education Program. It's a complement to the program by giving the resources to community health workers to increase awareness at the community level. It has all sort of resources. In the previous version, we used to have a bag and we used to have a flip chart and many other resources. But after the pandemic, things changed. And when we were doing the focus group and the in-depth interviews with community health workers, they were the one who came up with this idea on how to have a contemporary version of the Road to Health Toolkit. So now the new version of the Road to Health Toolkit, it looks like this. We're still keeping some of the features that we have in the previous version, which was using the storytelling approach. We find out that the storytelling approach works beautifully for African American, Black communities and Hispano-Latino communities as well. And also for the American Indian population. We used to have the flip chart for the American Indian population. Now it's going to be updated, that version. That's the last piece of the Road to Health Toolkit, because the English version has fully updated. It's available in our website, and the Spanish version as well. So we use the storytelling approach, which is what you see in the slide that says lesson type 1, diabetes is preventable and losing some weight can help. It's the story of a family on the route of how to prevent the onset of type 2 diabetes. It has this component. They have a user guide who describes all the resources in the toolkit and suggests ways on how to use them to promote type 2 diabetes. I always said to people, read first the user guide, followed by the group leader guide, then the participant guide, and then the activity guide. We have the tendency, let's say you are looking for something that you have to build like a drawer, for example. You just open the box, put all the pieces, and try to do it on yourself and put the instructions assembly on the side. We all do that, and then we end it, having things that doesn't match up, you know, a lot of parts that we never use, and a drawer might be shaking because we were not able to follow the instructions. So here is the same thing. Read the user guide first, followed by the group leader guide, then the participant guide, and then the activity guide. So what is the group leader guide? The group leader guide discusses type 2 diabetes prevention and is delivered through the story of an adult brother and sister with diabetes in their family who teach people how to prevent type 2 diabetes, can be prevented or delayed. Then you have the participant guide. These are resources for a group or participant. It should be used in conjunction with the group leader guide since its lessons and topics align with the group leader guide. The presentation slide as another version of the participant guide to be used as a presentation tool to display the visual for each topic during the session. And then you have an activity guide. The activity guide suggests specific activities to promote making healthy food choices and physical activity among your participants. And then last but not least, the evaluation guide that helps you plan how to get feedback from your participant and use the information to plan future sections. This is what we heard from community health workers. They need the resources they need to go back to their communities, work with the communities in the arena of the prevention of type 2 diabetes. The activity guide, for example, those activities is just a collection of activities that many community health workers has been implementing in the communities. They were just so generous, giving back to me, and I included them there. And that's how we know that those activities work, because has been implemented by seasoned community health workers for many years. It's just an adapted to be working in the prevention environment for type 2 diabetes. And then we also have videos and podcasts. Why? Because in the first section, we used to have a CD, DVD music with music, Latino music for the Hispano-Latino population. We have salsa, merengue, cumbia, techno, all of that. And then for the African-American Black communities, we have their version to more gospel type of music and stuff like that. So when I was doing the focus group and doing the updating, there was the idea of the community health workers say, don't lose the music, Betsy. Don't lose the lyrics, because you have health-related lyrics within the music. And what about if you take them and convert them into podcasts? What a brilliant idea. Yes, and that's how we switched from the CD, DVD to podcast. And then we kept the videos as videos. So you have now that available to help people increase physical activity, because one of the things that we find out is that in African American and Hispano-Latino communities, especially those that are living in areas where going out and do physical activity could not be done because they don't live in safety environment, dancing is a way to incorporate physical activity. So you have the music, they'll listen to lyrics that have health messages. So you're using other senses of the body to get the information and yet be active in the safetiness of their homes by dancing. What a great way to increase physical activity. So you have that available there. So then you have other worksheets that support the lessons in the group leader and participant guide. And all of them are located in our website, so you can download them. It also has posters. In the previous version, we have printable PDF posters. Now, what we have done is that we recreated those posters, and they're available as a PDF too, but they're also online animated posts. That was another community health worker who gave us the idea to develop that. So then you can use it as gaming. So introducing the gaming strategy around healthy eating, for example, in the traffic light methods, you are not only teaching people how to classify food based on red, for example, that means stop, you should not be eating that, versus yellow, yeah, you can take it, but with caution, and green, go ahead, like salad, for example. But then also you can play around with them online so they can learn what are the things that they could include in a healthy meal plan and what are the things they have to be cautious and what are the things that should be avoided. Then this one that is there says City of Solution. The previous version was something like, welcome to the city of excuses, where doing physical activity is not a priority. When we developed back in 2008 and 2005, that was the title that those group of promotoras gave it to me, and we put it like there, and it worked. But when we did the revision, this group of promotoras said, Betsy, that sounds like negative messaging. What about if we change to welcome to the city of excuses to welcome to the city of solutions? Because we have to brainwash people to think in a way that positively be engaged in doing the behaviors that are expected and needed and that will be helpful for them. And that's how welcome to the city of excuses changed to the city of solutions. And this is a good tool to help your communities, the people you serve, to really identify what are the challenges and barriers they have to be physically active, and what are the things they can do to overcome those challenges and barriers that they may have. So, as I said, we have also those interactive posters that have online game version and have version with clickable icons and pop-up boxes. And we try to make it, you know, from the visual aspect, very inclusive, so you can use in the different populations that you serve. So as I said, there is a Spanish version. And in the Spanish version, the story is about Camila and Jorge and the journey of the Familia Cruz on how to overcome the challenges to prevent the onset of type 2 diabetes. There are some other resources that I would like to share with you. These are publications that has been created in collaboration with National Association of Community Health Workers. And they're here for you. Enjoy the reading. Advancing Health Equity in Diabetes, Tool to Help Remove Barriers to Health. The role of community health workers in addressing food, nutrition, security, and social support during COVID-19 pandemic. And COVID-19, supporting their role in current public health resources. These are some of the publications that I have been working with community health workers and National Association of Community Health Workers that are there for you to read and enjoy and use. Then another resource that we have is called the Program Champion Strategy. This is a great resource to support existing recruitment and outreach activities. It uses current and past national DPP program participants as program champions to help engage with potential participants. It's implemented in 4 steps. Step number 1, get familiar with the program champion strategy. Step 2, identify possible program champions. And step 3, engage program champions. And the step 4, support program champions in reaching potential participants. It's a whole champion strategy for increasing recruitment. Then you have resources for lifestyle coaches and champions that include Quick Start Guide, recruiting and training champions, keeping champion engaged, using the program champion strategy virtually, talking points and activities and communication tips, and handling tricky conversations. Those tricky conversations are the people that might be in the phase of pre-contemplation. You know, they are realizing, well, I must be doing something to lose this weight, or might be doing something to manage my diabetes, but they're actually doing nothing. So how could you handle those kind of conversations with those people that are not ready yet to move from the contemplation phase to the contemplation and then implementation phase? Then, talking about videos, how powerful they are to spread messages that are sometimes hard, especially with people with low literacy issues. So you have here the Diabetes Kickstart. There are 7 animated videos about diabetes. It's the 7 healthcare behaviors that I was talking before. Each video is addressing one of those behaviors that I showed you before. Show the steps people with diabetes need to start to managing diabetes. I call them like the short and quick version of any curriculum for people with diabetes based on the ADCS-7. They're available in English and in Spanish, and they have companions handout that are going to be coming soon. We're working with them as we speak. That will be your homework. Look to our website to these resources so you can take full advantage, and I'm hoping you will be able to find them useful and use them in your communities. And then this is my most recent baby that I just birthed last week. It has been published in our website, and it's the DSMES Health Literacy Tool. We find out in the formative research that we were conducted that one of the greatest indicators for health and well-being is the literacy level. Why? Because the literacy level is how people use the information to act upon that information. What are the things that are needed for people with diabetes so they can self-manage the condition? Because as you know, knowledge does not help you change behavior. Tell me about it. I have been in the arena of healthcare for 30 years. And I went to that way of 344. Did I knew all the implications about morbid obesity? Of course, I have the knowledge. I have been teaching people. I have been teaching healthcare professionals. I have been doing research in that area. I have been doing publications. But I wasn't able to manage my weight. Why is it that is needed for a person to change their brain, the wire, and make the changes that are needed so you can live healthy life, productive life that I am living right now? I'm telling you, I'm a Vidalicious of 68 years old, and I go to the gym and I'm lifting 60 pounds. I have been getting back my muscle mass. I am able to do activities on the floor. I work my neighborhood 3 times at 3 rounds, you know, in a morning, every single morning, and I'm able to do it. I'm able to tie my shoes. I'm able to wet my feet. I'm able to dry my feet. I'm able to do things that I wasn't able to do because I was living with obesity. I find now, you know what, that I have neck. Isn't that amazing? I do have neck. And all of that is possible by having that village who have been working with me, my dietitian, my endocrinologist, my primary care physician, my promotora, my coach. It requires a village to live with a chronic condition like diabetes and obesity. It's not easy. I'm telling you, it is not easy. And in top of that, you're having issues with literacy, it gets even more complicated. So the DSMES Health Literacy Toolkit is designed to enhance the ability of diabetes care education and support specialists, but also promotores, to deliver effective diabetes self-management education and support services. Diabetes care education and support specialists and community health workers can use impactful visuals, clear messaging, comprehensive educational materials in this resource to connect with individuals across diverse health literacy levels and English language proficiency. I'm telling you, this is a tool that can actually, it's not the panacea, it's yet another tool, but it's a comprehensive tool that will help people address the issues of health literacy, which is a huge problem in people with prediabetes and people with diabetes and any other kind of condition as well, I will say. And then coming soon, I am working right now on a bilingual photonovela. This photonovela was created a while ago, I would say 2010, and now I am updating. I'm looking to the signs to see how the sign has been evolving. I have been talking with many community health workers. I'm going to be doing a pilot test right now. So stay tuned. You might be rich. And it's not free. You know, I don't enroll community health workers for free on my focus group. Everybody get paid for those. I make sure that you're treated correctly and respectfully. So this bilingual fotonovela is around raising awareness about the higher risk for type 2 diabetes among Hispano-Latina communities and provide tips for prevention. It's a revised, and that was another community health worker idea, from a paper PDF-based fotonovela to a motion graphic novel in video format. It's becoming beautiful. The fotonovela follows Lourdes, which is the main character, and she makes healthy lifestyle changes with support from friends and family, emphasizes the importance of being healthy, highlighting increasing physical activity, healthy food choices, seeking support, and taking small steps to reduce or delay the risk of type 2 diabetes. It's animated. We did the first focus group. We went ahead and have been working tireless in making all of those changes and comments that we got them. And now I'm ready to move on to pilot testing. And I was telling my contractor, we need to find fearful community health workers that will have no regret on telling us if what we're putting here is what we heard, if they think that this is something is going to work in the communities, if this is a resource that they can use effectively in the communities. I want to hear from you, in other words. I want to hear from you is that this motion graphic novel in video format, it's what you actually need out there with the messages that you need out there to reach Hispano-Latina mujeres, women, and communities with tips for prevention of type 2 diabetes. How much time do I have, Roberto?
That's a great question. So we have just reached 4 o'clock. So unfortunately, we do have to kind of transition over to the next sessions. But this has been a fantastic presentation. Lots of great participation from the audience. I'm looking into potentially distributing the slides, how we can go about doing that.
Yeah.
I have, Betsy, I have your contact information that I can access the slides from you. And then if folks can either leave your email addresses in the chat, or we might also, I'll confirm with the other tech support folks, but we might also be adding them to the website for folks to access post-conference. So hopefully be on the lookout for that, but I'll try.
That'd be great.
Try.
This is this is my last slide, which are the takeaway, and the next one, it's my information, bjr6@cdc.gov. Thank you very much for joining me today. Thank you. And thank you, Robert, for your support.
Of course. And I posted in the chat a little bit ago, but there's a sessions beginning at 4:15, so it's a pretty quick turnaround. So if you want to access the website and join the link for one of the next sessions, the B sessions, please do. And those will be beginning promptly at 4:15.
Okay, thank you.
Yeah,
I'll be joining you all there. Thanks. Gracias, Roberto.
Of course.
Bye.